Okay, well, welcome everyone. It is such a pleasure to have you for our wellness support group. This is a monthly meeting where we all meet together just in support of each other's wellness journeys. It's not easy to either keep your good health or to improve the quality of your life and the quality of your health if you are already feeling stressed and compromised. So tonight's topic is on an overabundance of yeast. If you're diagnosed with an overabundance of yeast in your body, they may call it Candida. And I know for me, many years ago, that was a huge problem. And I even believe that it was the basis for just the struggle that I had with my health over the days, weeks, months, and years. And it was not easy to get on top of that. It took me about 18 months of dedicated, diligent effort. But I can tell you that it is possible. So if your body is struggling with an overabundance of yeast, there is hope to get it under control and to get on top of it so that you are able to function normally and not having it cause havoc with your immune system. Okay, so how we usually do it is Larry will present the topic, and then afterwards, for those of you who are on live with us, stay on and we will be happy to then take questions and answer whatever questions you want, even if it is not related to the topic. So I'm going to turn the time over to Larry, and then I'll be back with you at the end in case there's any questions I can help with. But both of us will be here with you for those of you who want to stay. Okay, I got to see how low I am. The chair is so low. I got to get my shoes on. Okay, here's Larry.
Okay, hello everyone. Let me pull up the slides and share them with you so that you can see these slides that I've prepared. And here we go. Like this, and you should be able to see, those of you who are watching, you should be able to see my picture up at the top and the slides right below. And as Angie mentioned, we will be talking about Candida. And there are hundreds. If you're confused about this, there's good reason, because there are hundreds of Candida species. And what Candida is you'll also hear the term yeast. Yeast or Candida, they are single-celled microorganisms, and they go along with molds and mushrooms and fungus. So yeast is a small microorganism, single-celled, and they can cause infections in humans. The most common one that people are familiar with is Candida albicans, is the technical name for yeast. And Candida will normally live inside the body without causing any problems. So it's kind of like you have good bacteria and bad bacteria, and both are actually necessary. If you had only the good or just the bad, either case would actually not be good for your body. It needs to have those opposites, because the positive and the negative, the yin and the yang, the pull back and forth, the up and the down, everything kind of works together with its opposite. And there's always an interplay between those two forces. And it's the same thing with Candida. When it gets out of control, then it causes a problem, but you need to have it, and it's present in the body. It's present in lots of times your mouth, throat, gut. For girls, it can be vaginal. It's also on the skin. But Candida yeast can cause infections when they get out of control. And depending on where they are at, either on the surface on your skin or deep within the body, it can cause that infection can grow, and it can become a bigger problem because it goes in the bloodstream or internal organs like your kidney, your heart, or your brain. And then those infections become quite serious. Candida that develops in the mouth or the throat is often called thrush. And with babies, you'll sometimes hear that terminology thrush. Formally, it's called oropharyngeal candidiasis. Thrush is a lot easier to say. Candida that's vaginal is often referred to as a yeast infection. People will say a yeast infection, and that's when you have that in vaginally. Invasive candida occurs when that yeast enters into the bloodstream and gets into other organs like the kidney, heart, or brain. And that's called invasive because it's gone way beyond where it normally lives and is now infecting other internal organs. And that's not a good thing. Sometimes candida can multiply and cause an infection if the environment inside the mouth, the throat, or the esophagus changes in a way that encourages fungal growth. That lots of times is dark and wet. So when you think of fungi, you're thinking of mushrooms, and they like it to be dark and wet. And that's where candida will thrive. So it's common to see it in the mouth and throat. You can often have white patches on the inner cheeks of your mouth, or maybe on the tongue or roof of the mouth, maybe down your throat. Those white patches, if you look at a baby who has thrush, is a sure sign of candida. It can cause redness or soreness. Your mouth can feel like cotton. Your taste, you lose your sense of taste, or you have pain while you're eating or swallowing, and you can have cracking and redness around the corners of your mouth. All of that indicating you have a yeast infection. Here's a picture for those of you who are watching the presentation on your computer. That white is the yeast, and so it's gotten out of control and is now kind of rampant. To have it in the mouth or throat or esophagus is not very common for healthy adults. Children will get it, babies primarily, usually those that are younger than a month old. But other people can get it. If you wear dentures, you have diabetes, cancer, HIV, AIDS, or if you're taking a lot of antibiotics or corticosteroids, maybe for asthma, medications that dry your mouth out, or if you're a smoker, you can be more prone to getting candida. But typically, most adults do not have it in the mouth, throat, or esophagus. You have to be compromised or a little baby generally. Drug treatments are used to treat mild to moderate infections. And typically these are antifungal medicines that are used for 1 to 2 weeks. Medications maybe you've heard of, I have listed here on the slide, clotrimazole, miconazole, and nystatin. If you have a severe infection, they may use fluconazole or diflucan, as it's known. So, for those of folks who suffer with vaginal candida, the symptoms that you'll have is it can be sore. There's vaginal itching or pain during sexual intercourse. You can have discomfort when urinating, and you can have a vaginal discharge that's not normal, excessive. Normally, most women will have suffer from vaginal candida, but and so there'll be some redness and swelling and cracks sometimes when it becomes more severe. But the mild forms um, just include discomfort, pain, When you get to the point where you're having vaginal issues with redness and swelling and cracks in the wall of the vagina, that's more serious. Treatment, of course, is with antifungal medicine. Invasive candidiasis is that candida that has gotten into internal organs through your blood. It can get into heart, brain, kidneys, as we mentioned, but it can also get into the eyes and bones and other parts of the body because the bloodstream will just carry that yeast everywhere. Candidemia is what it's called when it's in the bloodstream. It's just a yeast infection in the bloodstream. Candida auris is a fungus that is, it represents a serious global health threat. We're having more and more of it. There are more healthcare facilities in many, many countries that are reporting Candida auris. And it causes severe illness in hospitalized patients. And so this is an invasive form of candida that's yeast based, but is causing problems in internal organs. And this particular fungus is resistant to many antifungal drugs, so it's hard to treat, especially deep within the body. Those people who are at high risk for this type of candida are usually people who've spent a lot of time in the ICU, the intensive care unit. Maybe they've had a central venous catheter, a weakened immune system, for example, people who are being treated for cancer, chemotherapy, organ transplants. Anytime you have a low white blood cell count, your immune system is compromised. Sometimes people who've had surgery, especially abdominal surgeries, or if you've received a lot of antibiotics in the hospital treating these infections. Some people are more prone to it if you're receiving your food through a tube through your vein called parenteral nutrition, or if you have kidney failure and you're on dialysis. People with diabetes and preterm babies are all at increased risk for developing invasive candida. Of course, preventing is always what we strive to do to keep this under control before it becomes invasive. Tips to prevent yeast infections involve limiting the amount of sugar and processed foods that you consume because yeast, they thrive on sugar. Only use antibiotics when absolutely necessary. The reason is because you kill not only bad bacteria, but you kill good and bad bacteria. And when you lose the bacteria, those are the guys who are processing your sugar and breaking it down. And if you've got too much sugar going into your bloodstream, the yeast infections will thrive. For vaginal yeast infections, try not to spend extended periods of time in wet clothes or bathing suits when you're at the beach because yeast loves to grow in moist, warm environments. And so when you're swimming, it's good to wear loose-fitting, non-GMO cotton underwear. Don't use douches or vaginal deodorant sprays and scented lotions. All of that alters the good bacteria, and the yeast in the vagina starts to thrive. So the balance between good and bad gets altered, and so the yeast starts to spread. Some of the non-drug natural remedies that people can use that are helpful, besides, people turn to the drugs, but for prevention and for treatment, if you can do that without taking drugs, of course, the sugar nutrients, the glycans that we teach about in class are crucial. They're very, very helpful for strengthening your immune system and allowing it to communicate properly. Pre and probiotics. Greek yogurt, again, because of the bacteria that you can get out of that to balance your system. Boric acid can be very helpful. Boric acid is used it sounds like a horrible thing, but it's actually a very helpful, mild treatment that can alter the pH levels in bodies. Essential oil of oregano, coconut oil, tea tree oil, apple cider vinegar, garlic, hydrogen peroxide, and vitamin C have all been used and have varying levels of help. So if you anything on that list, if you haven't tried that, they can be helpful to you. So that's the presentation on Candida. Let me turn the time back over to Ange, and I'll bring her back on here, and we can answer questions here.
Get your chair. Bring the chair over. Okay, well, some of that might have sounded like we were suggesting that you could treat, cure, or mitigate your disease if you are diagnosed with Candida. But of course, we are not suggesting any of that. It's just, of course, your option to go and get medications from your doctor to try to get on top of it when those things are driving you nuts. The Candida or the yeast, an overabundance of yeast can drive you crazy. And for me, I did that. I went that route, and that's exactly what I did for many years, like 15 years. And I got to the point where I was taking one of the diflucan. I did nystatin also, and I was taking one of the little pink pills. I think it was pink back in the day. It's hard to remember now, but I was taking one every single day. And I remember when I went to the pharmacist, and I think it was the first time I had this huge realization that I could really hurt myself by taking so much of this medicine. Because I went to the window, and the pharmacist leaned, to hand me my prescription. He leaned through the window and whispered to me, "You cannot take this much." And I just stood there in my tears. I was going out of town. My first grandbaby, who's now 20 years old, had been born. I wanted to go see him, and I was sick. I was always sick with the infections, terrible infections. And I knew that I would run out, and I had to have it because I couldn't even function with the misery that I was in if I didn't have the diflucan. And so I had gone to get the prescription from the Air Force Academy where we lived in Colorado Springs. But what he didn't know is that I had already gone to Walgreens to pick up the exact same prescription from another doctor. And I was planning on doing both of those prescriptions, just hoping that I wouldn't run out. And when he told me, "You cannot take this much," and I said, "What can I do? I have no idea. I don't want to take it, but I don't know what to do. It's so miserable." And he said, "I don't know, but I just know that this is not safe. This is dangerous." So it was at that point where I just kind of hit the very lowest, and I knew something had to change. I also had a cervical biopsy that came back positive. I was dealing with raging infections with both UTI and yeast, just a vicious cycle because the antibiotics which I didn't know, but it fueled the yeast. And of course, my diet, highly refined diet, not as bad as I didn't think I was doing as bad as most people, but I was not doing as well as I could have been doing, which I learned later. So diet is so important. If you are able to take medicines on the market and you get better and you can change your diet and everything is good that way, that's awesome. There's a reason why we take medicine, and I'm not against that. But if you are having to do it every single day to keep from being in a serious situation, you're constantly interrupting the natural human physiology. And when you do that, it's only a matter of time before everything continues to break down more and more and more. Your body gets used to something else going in and making it happen. And then pretty soon it can't make it happen anymore. And that's where I was at, and it was serious. I was immune to, there was no antibiotics I could take any longer. So for the UTIs, the bladder infections, I couldn't take any more antibiotics. And that was scary. I was going to be put on a kidney transplant list, the doctor told me, if I didn't get this under control. And I said, what can I do? There's nothing that is working. Like literally, I had to be on an antibiotic every day also. And that's not healthy. You can't do that. So I was in a bad situation and seriously was in real jeopardy of losing my life just from infections, not to mention everything else that I was dealing with, 3 autoimmune. So I believe that the overabundance of yeast was the beginning of a lot. I want to say the culprit, and it may have been the culprit, but I know inflammation was also a big problem. And it was a journey. It was a journey. So cleaning up our diets. If you want to get on top of an overabundance of yeast, whether you're diagnosed with anything specific or not, you got to clean up your diet and cut out the highly processed, refined sugars and refined foods. You've got to eat a lot more vegetables. And since our food is so lacking in the nutrition that it should have, you've got to supplement key components. And those are the things that I did, and I was able to get on top. So it took 18 months for me, and I haven't actually been back to a doctor now for 16 plus years. So it's quite amazing, but it was a journey. No magic solution, and there's nothing that we're suggesting goes in and actually treats anything specific. It's simply those suggestions of the list we gave you, the exercise, I mean, not the exercise, well, exercise is good, of course, but I mean the diet, changing your diet and all of those types of things, incorporating good critical nutritional components. All of those things are important and needed, but we're not suggesting that they go in and treat anything. They simply are put in place so that your immune system can start functioning the way that it knows how to function. And when that happens, you have a very good chance of getting on top of what's gone awry and allow your immune system to do that job. It's remarkable. So, okay, well, we're going to stop the recording now. Thank you for joining us, those of you who are listening to this in the replay. For those of you who are on live tonight, we always love that. Thanks for hopping on. We're going to stop the recording. You stay with us, and we will answer whatever questions you have. And for everybody else, we'll hope to see you next month. What is the topic next month? Do we know? Oh, I always think to say that the last second. Let's see if Larry can pull it up real quick.
Sunscreen and vitamin D.
Okay, it's on sunscreen and vitamin D. So hope to have you next time. We'll see you all. And hang on, everyone who's live. We'll be right with you. 1 second.